If you're a woman 35 and over and noticing weird symptoms, don't ignore them. They may be signs of perimenopause. So let's unpack them. Let's unpack what's really happening in our body during this time. My name is Dr. Casey Trapman. I am a board certified menopause specialist as well as an obesity specialist. And we're here to talk about the many symptoms of perimenopause in our series, Menopause A to Z. So we're at letter H right now. And for H, it has to be headaches, right? Headaches in perimenopause is actually very common. They become more frequent or intense. If you already have a history of migraines, they can become very frequent or intense during perimenopause. And here's why. Estrogen influences our brain chemicals like serotonin, which affect our blood vessels and not to mention our mood. Okay, so when estrogen levels fluctuate, it can trigger tension headaches. What especially happens more when we have that deceleration or rapid decrease in the levels. Okay, so but we also know that the typical triggers of migraines are poor sleep and stress, and these can actually make an existing migraine diagnosis worse. In my practice, women living the up level midlife, we utilize the 4M approach: meals, movement, mind, and meds. We do know that patients that are struggling with migraines that are worse in perimenopause can get better. They feel so much relief when we initiate treatment. Specifically, FDA approved hormone, estrogen, and progesterone. They can help stabilize symptoms because they can help stabilize the fluctuations that happen. Headaches in perimenopause can be super frustrating, but remember, they're not just random. They're part of how hormone changes affect both our brain and our body. And relief is super possible with the right support. Patient story: I could use myself because I'd say maybe mildly struggled with migraines in my adult life, but it started becoming worse during my 30s. And of course, I attribute it to life and stress and caffeine and everything. Of course, these are all correct triggers, right? I'm not saying that they're not correct. But for me, initiating hormone therapy for me was life changing in terms of my headache control. I can share another story from one of my patients who would have really bad headaches um, the first 2 days of her menstrual cycle. It was debilitating. She would tell me she would have to take regular Advil. She would need to be in a darkened room and really becomes incapacitated for every month for those 2 or 3 days. With hormone therapy, I'm so glad to share that she is just stabilized. She's headache free during those times. And she loves the fact that she can live a regular life during those days. So if this is you, sounds familiar, I would love to help you find relief from this debilitating symptom of headaches and perimenopause. Midlife Remedy, let's chat. Let's go. Let me help you. So here at Midlife Remedy, we turn chaos into clarity, and symptoms into solutions.